I wish to take this opportunity as the Executive Director of Kenya Society for the Blind to just give our key highlights during the implementation of the Vision Impact Project that has been funded by the Christian Blind Mission, CBM International. And just to say that it was a transformative moment for Kenya Society for the Blind. When we started, it was after COVID-19, and we were just trying to place the society in a trajectory that would really mean more for our clients and service delivery. And this project really came handy in reshaping our systems from governance, in terms of the policies that we've been able to put in place with the aim of ensuring efficiency and effective delivery of services to our clientele. We really appreciate the fact that we've been able to change the environment of our employees, our students, and also the clients who come to seek eye care services at the headquarters here from the renovations that were carried out. And this has really enabled KSB to stand out in terms of comprehensive eye care services and coming with a model of care that can be emulated by counties. This is because we not only just do the medical bit of screening and treatment and surgeries, but also we are able to offer rehabilitative service to those who are confirmed to be blind, giving them assistive technology skills so that they can live independent lives. In a nutshell, we were also able to support the education sector by renovating 7 inclusive schools and also equipping education assessment resource centers in the 7 counties where VIP was being implemented. KSB delivered big in spectacles where all patients who needed classes, they were given through our systems, and this has really enabled KSB to remain with sustainable vision centers, where we projected a total of 8 in our strategic plan, and to date we are running 22 vision centers that are enabling citizens of Kenya to access optical services at affordable rate, so in their various counties. I think this is another major step in trying to strengthen government health systems and encourage continuum of eye health services within the public facilities. And we really appreciate the Vision Impact Project for making KSB go to the next level in terms of its service delivery and appreciating the need to leave no one behind.
I'm David Munyando. I work in the role of the Country Director for CBM Christian Blind Mission, Kenya. CBM was founded in 1908 with the main mandate of working in partnership to improve the quality of life for persons with disabilities. In Kenya, we work through partnerships, and we have areas in health around physical rehabilitation, ear and hearing care, and also prevention of blindness. We also have programs in socioeconomic empowerment, inclusive education, as well as humanitarian action. Vision Impact Project was rolled out in the year 2021 after the realization that there was a new strategic plan for eye health for Kenya, 2020 to 2025. And CBM having been part of it, we saw the duty and obligation to support its implementation. So we had to map 10 counties, out of whom we were able to support 7 counties. That's Kwale, Embu, Meru, Kajiado, Kiambu, Bomet, Vihiga. In the design of this project, we focused on system strengthening around eye care to ensure that nobody in Kenya acquires avoidable blindness. We work together with the Ministry of Health at the national level, the Council of Governors and respective county leadership, Ministry of Education, Ministry of Labor and Social Protection, the National Council for Persons with Disabilities, Peak Vision, and 7 partners, among them Kenya Society for the Blind. Our aim was to work closely with the county governments to strengthen demand on eye care, to strengthen the supply side, that's in terms of service provision, and also to improve eye care governance in terms of coordination as well as governance tools. We are also reminded to work within the framework of Vision 2030 Insight under the International Agency for Prevention of Blindness, IAPB, which was really keen to also ensure that partners work with governments to strengthen systems and to elevate eye health into political agenda. So this was really a good inspiration. And also we are reminded that we have Agenda 2030, which was very keen in ensuring that nobody is left behind in the development framework. So working on this, we designed a program that was keen to develop a human resource for eye health, procure and equip eye health facilities, construct eye health units, as well as do renovations and improve accessibility, improve data capture and analysis through use of peak vision technology, support surgeries and also provision of spectacles through establishment of optical services at the county referral facilities, and equally implement a very robust outreach programs in school as well as community.
My name is Solomon Buhala. I work for Kenya Society for the Blind as a Vision Impact Project Coordinator for 7 counties where the VIP is being implemented. VIP is an eye health project, comprehensive eye health project that Kenya Society for the Blind has specific deliverables that is making the eye health to be complete. The society focuses on inclusive education. It is also focusing on matters, issuance and distribution of spectacles. It focuses on rehabilitation in schools and in the community, and then also focuses on matters to do with the low vision. VIP began actively in 2021, and the key partners were in every county of the 7 counties where KSB was cutting across. In Kwale, we have Kwale Eye Center, which is the lead partner, that had its own deliverables separate from those of Kenya Society for the Blind, but we were working in conjunction. In Kajiado, we had Operational Eyesight that are our lead partners, and they have specific deliverables, but we work in harmony and in consultation. In Kiambu, we have Kikuyu Eye Hospital, And in Embu, we have Fred Hollows. In Meru, we have AIC Ministries. In Bomet, we have Tenwek Hospital. And in Vihiga, we have Sabatia Eye Hospital. These are the main players, but we have PIC. PIC is an organization that also is very key, because we are using the PIC kit in screening and identifying. So this organization is very key. We have, of course, government departments that work very closely with us within the counties. We have Ministry of Education. We have Teacher Service Commission. We have the Department of Social Services. And of course, the National Council, representatives within the counties work very closely with Kenya Society for the Blind.
Teacher in charge of police special unit, catering for learners with visual impairments. We've been having many challenges in the school that we are not even able to contain some learners here. We used to refer them to other facilities, but thanks to Kenya Society for the Blind, they visited us one day. They saw what we were going through, and then they promised to come back. When they came back, they came with goodies. They repaired the roads leading to the school. They cleared everything that was hindering these special needs learners from moving. They made ramps to the classrooms, because apart from the visually impaired learners, we have those with physical impairments. So they are not even able to get to the classrooms, but because of the Kenya Society for the Blind, these learners are now okay. They are mingling with others. Even when they go for games outside the classroom, they are able to play with others. In the classroom, they are able to move in a good manner because everything is okay. The roads are smooth. All the obstacles have been removed. So we thank the Kenya Society for the Blind for visiting our school, and I know there are more goodies on the way, and I know they'll bring more partners so that we want this school to become a fully equipped school for the visually impaired learners, and we even want more braillers so that these learners are not referred to other facilities.
Majina yangu naitwa Samuel Eloga Akibaya. Mimi ni mkazi wa Mkingi sub-location, Izava South location, Sabatia sub-district, Vihiga County, katika mtaa wa Mbale. Mimi niliweza kupoteza uwezo wangu wa kuona nikiwa mtu mzima, an adult. Na nilipata changamoto nyingi kwa vile sikuwa najua mahali pa kuanzia ama pa kuendelea. Lakini kwa bahati nilipata fununu kuhusu shirika la KSB, lakini kasikia wako mbali, wako Nairobi na mimi niko Mbale. Kwa bahati nikapata ripoti ya kwamba wako na ofisi mpaka huko Mbale. Kwa hivyo nikachukua jukumu, nikaenda kwa ofisi ya KSB na wakanipokea na wamekuwa wakinishughulikia vizuri sana, kwa sababu walinisaidia kwanza na kunipea mkwajo wa aina Hoitken, na wakanipea mtu wa kuwa akiendana na mimi katika mafunzo amenifunza jinsi ya kutembea peke yangu, ile inaitwa orientation. Wamenifunza mpaka kufanya vitu kwa nyumba nikiwa peke yangu, yani ile independent living skills. Na bado tunaendelea na wao kwa sababu naamini watanifunza mambo mengine mengi niwe independent kabisa bila kushughulika ama kusumbuana na watu wengine. KSB hapa Mbale nilipata kupata ripoti yao kupitia kwa mzee wa kijiji. Alafu nikaenda kwa ofisi ya National Council, ndio wakanielekeza kwa ofisi ya Kenya Society for the Blind. Na wamekuwa watu wa msaada mkubwa sana kwangu. Siku hizi sina wasiwasi, hata nikitaka kwenda dukani najipeleka nikitumia hoist cane. Nikitaka kujipikia hata chai wameshanifunza. Naweza hata kuandaa vyakula. Familia yangu inafurahi. Hawana wasiwasi hata wakiwa mbali na mimi, kwa sababu wanajua nitajimudu. Na najua nikiendelea nao, nasikia kuna gari zinakuja ambazo zinatumia remote, naweza kuwa nayo pia, sitakuwa na wasiwasi. Na pia walinieleza wanaweza kunisaidia baadaye nijue mpaka kusoma braille. Na ngojea wakati watapata hiyo nafasi na vifaa ambavyo vinahitajika, ndio niendelee na mafunzo zaidi na zaidi. Na pia hata mimi nijitolee kuhimiza wenzangu wenye wanaweza kuwa wamepoteza uwezo wao wa kuona na bado wamejificha pengine ama wamefichwa na familia, wajue hakuna ambalo haliwezekani na mtu anaweza kupata msaada na aishi maisha ya kawaida na ulemavu. Pia naweza kushukuru watu wa KSB sana, kwa sababu kila mara wamekuwa wakinipitia, kuniangalia na kunielekeza mambo mengine mapya ambayo yanaendelea. Wamekuwa wakinifunza mpaka kutembea kwa njia ndogo zile zinaitwa block routes. Wamenifunza mpaka kuvuka mto, stream na mambo mengi. Siku hizi sina wasiwasi ati naweza kutumbukia kwenye maji ama nikajikwaa kwenye jiwe, kwa sababu wamenifunza jinsi ya kutumia huu mkongojo wa white cane, ambao pia lazima uwe na mafunzo ndio uweze kutumia. Uweze kutumia tu kama mkongojo wa kawaida. Asante.
I'm Grace Onacha from Vihiga County, Hamisi Sub-County, Jokoyai. Been trained by Kenya Society for the Blind as a community rehabilitation assistant. Before we were trained, there were a lot of challenges when it came to visual impairment. We had very many people in the community who were visually impaired, but they were not actually being reached. But after the training by Solomon, we were able to go to barazas, to go to groups and train people on visual impairment. I thank Kenya Society for the Blind because one, they gave us free clinic. They gave our community spectacles, and that brought a big mileage. After being trained, I've been giving the community the white cane. There are some people who could not leave the villages because of the mobility aspect. But since we gave them the white cane, they can now access school. We had 3 children in one family, but now they can access school. That is a plus for Kenya Society for the Blind. We had very many cases of elderly who are visually impaired. We again gave them the white cane. We trained them on how to use the white cane. Now they are happy, they can go to markets, they can go do their daily chores because of the white cane. There is a lot which the community was missing when it came to visually impaired. Some thought in our culture these are children who have been cursed, but it is not like that. After the knowledge we gained from Kenya Society for the Blind and we narrowed it to the community, the community is now taking their children to schools, and they are taking them even to regular schools where they are being trained. We are now pushing for inclusivity, whereby every child is to get education. They should not only stay in special schools, but they can even interact with the other students in normal regular schools. So this is a plus to Kenya Society of the Blind. I would wish the advocacy process to be a continuous process, because we started the program in 2022, and with the corona coming in, it had to dildo. That's why I'm calling for a continuous process so that we can reach everybody in Vihiga County. Not only Vihiga County, but I would wish everybody in Kenya to be trained by the Kenya Society for the Blind.
I am Samuel Chirchir from Kenya Society for the Blind. I am the Rehabilitation and Education Officer under the Vision Impact Project in Bomet County. There are several elements of interventions under the Vision Impact Project, one of which was mapping of Disability Services Organization. The second one was developing one inclusive school to be able to offer services to learners with disability. And one of the other aspects, including delivery of glasses, we also had an element of community-based rehabilitation, which entirely the program is meant to cater for persons who have lost their sight, but they are just within the community setting. They are supposed to be trained, but before that, they are taken through what we call acceptance drill, where they are told, yes, in fact, there is this loss, but then there is also a way out. They are taken through basic counseling, and then later on, they are told what exactly they normally do in the community. Maybe they are going to their toilet, or they are washing their dishes, or they are basically doing their kitchen activities, cleaning and grooming. So the aspects of community-based rehabilitation is meant to train the person who has lost sight at their community setting, where they are always there to be able to get back to gainful activities of daily living, and even mobility skills like the use of the white cane to be able to move from one corner to the other within the compound. So some of these cases which we identified, of around 60 to 70 cases identified, around 40 have benefited in one way or another and have been able to accept their loss of vision. A number of adjustment skills have been done, including counseling to be able to accept their vision loss. Others have been trained on mobility, others have been trained on issues including gardening, to be able to tend for their small gardens at home. And others are trained to do a small skill on cutting, fire skills, though it is not advanced so much. They are trained alongside a very good caretaker, so that a person can be able to hear when there is maybe boiling point water, what are the sounds, or maybe they are pouring, they have their pouring skills. As you pour some fluid to another container, there is a sound change as the liquid approaches the brim, and such kind of common skills that are around in the community. So that is the aspect of community-based rehabilitation.
Kwa majina ninaitwa Onesmus Kipyegon. Mimi ninatumika kwa hospitali kama chaplain, na kupitia usaidizi wa Kenya Society for the Blind nimepata classes ambao nimeitumia kusoma Biblia. Ilikuwa ngumu kwangu kuweza kusoma Biblia, lakini baada ya kupata klasi hizo imeniwezesha kuweza kutumia kwa kusoma, na sio mimi peke yangu, kuna watu wengi ambao wamesaidika kabisa kupitia hii program ama hata hizi classes ambazo huwa mnatupatia. Kwa hivyo tunashukurani sana kwa ajili vile tumesaidika kabisa, kwa sababu hata mimi kama chaplain singeweza kuhubiri ama kusoma pasipo kwako na hizo classes. Kwa hivyo nimesaidika, na ninawashukuru Kenya Society for the Blind kwa kutusaidia, kutupatia hiyo msaada, kwa sababu hata watu wengine ambao hawangeweza kununua, hakika kabisa wamesaidika vizuri sana. Kwa hivyo tunashukurani na tunasema ya kwamba ikiwezekana tena hata hiyo program ipate watu wengine wapata kufikia, kwa sababu kuna watu wako kwa reserve ambao hawajui, hata wana habari ya kwamba kuna watu ambao wanaweza kutusaidia kama hii society ya Kenya Society for the Blind. Kwa hivyo fikieni hata kwa maresafu, alafu watu wengi wapate kusaidika kwa njia moja ama nyingine. Asanteni sana.
Kwa majina naitwa Beatrice Cherono from Bomet County, Sotik Sub-County. Nililose sight in the year 2018 due to brain tumor. And after losing my sight, maisha yangu ikabadilika. I was not even able to move one step to another. So because of Mr. Chirchir from Kenya Society for the Blind came, akanivisit, akanipea hope. Ile nilikuwa lose hope maisha, but he gave me a lot of hope. Nikakuwa hopeful, alafu and then I joined training in Kenya Society for the Blind. That was in the year 2023. So after training I have gained a lot. Nimelearn braille, nimetumia computer, what we call adapted computer, alafu simu nikaichua natumia simu vizuri, and then mobility. I'm capable to use this to move one place to another with the help of this white cane. After the training, nimegain more sana skills. After training, nimeachiriwa kuwa mwalimu, a P1 teacher, and I'm now very, very grateful sana kwa Kenya Society. Leo mimi naingia darasa nafunza watoto. So I'm very much grateful sana. This project of VIP imenipea hope niendelee maisha mbele.
I'm Joseph Malika, project officer, Kenya Society for the Blind, based here in Kwale. And I'm very happy about the progress of the project and the impact it has had on the people of Kwale, especially the aspect of low vision since we started in 2022 up to now. We have been able to cover the 5 sub-counties of Kwale County, that is Matuga, Msambweni, Lungalunga, Kinango and Samburu. And we have also been able to screen a number of schools and reach out to a good number of students. Over 1,000 students have been screened and identified, some given clinical intervention and some done placements in different schools within the county. We are also happy that we have been able to identify learners that were initially hidden in the houses, who are not able to go to schools. But due to the project, we have been able to see an increase in the number of learners that have been enrolled to schools. These statistics can be gotten in our EACs. The EACs at sub-county level, we have Kwale IAC, Kinango IAC, Samburu IAC, and even Lungalunga IAC, where we have been able to get monthly updates on the number of learners that are assessed on low vision and other cases of other disabilities, and we are able to identify those cases, refer them appropriately, right from the primary levels of clinical primary levels to tertiary levels, and able to give appropriate intervention to them. So as the project nears its end, we just want to encourage that the collaboration that has been there between Kenya Society for the Blind, CBM Christian Blind Mission, Kwale County Government, and Kwale Eye Center may be able to be extended even to continue even after the project, so that we ensure that even those learners that will be coming out soon, there are those that are being born. We cannot rule out the fact that there are those who will be born with low vision cases. So if this project can be extended, or if we can, the people that we have capacity building in the community, like the CHPs, like the public health officers, like the medics within the sub-count and the count, they can continue this aspect of screening, treatment, and also referring and placing students and learners in various institutions found within the Kwale County.
Yeah, my name is Teacher Omar Chanze Singwa of St. Luke's Integrated in Kinango. The school has a unit for learners with visual impairment, and through Kenya Society for the Blind, this institution has benefited a great deal. Our learners have both optical and non-optical devices to use in class and outside. We got this partnership, and it's been such a great inspiration. We not only keep learners, but we teach learners because of the devices and the interventions of Kenya Society for the Blind in partnership with other stakeholders. We have a program that ensures all learners with visual impairment, especially those who have residual sight, are able to use their remaining vision to the maximum, both in class, using the magnifiers, telescopes, the bold lined books, using mobility canes for those who are blind. We also have Victor readers that are good for audiobooks. We also got a computer and an embosser that will help us in putting their work into Braille, especially exams and other materials that would be of help to them. So we are very grateful, and we really would wish that this partnership is for posterity, considering we have so many learners outside there who need this intervention.
My name is Daniel Makau. I am an assessor here in Kajiado County at the Assessment Center. I do assessment for learners with special needs here in the IAC. This is the IAC Center for the Kajiado County. We have really benefited from the Kenya Society for the Blind. I underwent training. We were shown on how to handle the new assessment tools, which are really benefiting us. We also got assessment materials, and the assessment center was renovated. That one has really made an increase in the number, because now a great number can access the center. We also have the sensitization, which was done by the Kenya Society for the Blind. That has really increased the number of our assessment for the last year. since the training was done. So I'm so glad, and I thank God for the Kenya Society for the Blind.
My name is Henry Omondi Obenju, a teacher at Olkejuado Primary Boys Boarding School and unit for the visually impaired. In our unit, we have got a total of 14 totally blind learners, but the total number of learners with visual impairment in the school is around 26. I want to take this opportunity to most sincerely thank the Kenya Society for the Blind for partnering with our school. They have assisted our school in so many ways. One, they managed to construct pathways all the way from the office block to our resource room, all the way to our dining room. Therefore, most of our learners who are visually impaired can easily trace their ways from the dormitory to the dining hall to the classes and even to the staff room. Secondly, the Kenya Society for the Blind also constructed in our school a disability-friendly toilet that has gone a long way in assisting our learners who are visually impaired. Apart from building the toilet block, we also received assistive devices like low vision devices, the magnifiers, from the Kenya Society for the Blind. These devices are actually playing a big role in assisting our learners with low vision in their classroom. And last but not least, the Kenya Society for the Blind also managed to repaint and even do some repair in our resource room. And therefore, as we today, our learners who are visually impaired are actually learning in a very conducive environment thanks to the help that we got from the Kenya Society for the Blind. Once again, I want to thank the society so much for the assistance that they granted our school, and going forward, we are looking to this continued partnership with the Kenya Society for the Blind. Thank you.
Sub-county is Kajiado Central. I live with a disability, that's a low vision disability, and I thank the VIP project which has been brought by the Kenya Society for the Blind to Kajiado for actually their support with some of the low vision assistive devices where I got them, that is here within Kajiado, just here within Kajiado. They were made available by Kenya Society for the Blind, and I am actually, I can attest that I'm a beneficiary of those devices. Fortunately, I got the white cane. I have the white cane and also the magnifier. And these low vision assistive devices, they actually they are of benefit to me. They have actually made my all aspects of life to be possible. They have actually made my life to be easy. In terms of my job as a trainer, these assistive devices have, especially the magnifier, that is the magnifying glasses, it has made it possible for me to be able to access the various writings in different fonts, because it magnifies those fonts. It makes them to be big, so I can read them very comfortably. And also maybe in reading, I can read using them very comfortably. I can be able to see the fonts, whichever size. And so
they are very important to me, especially they have made my job to be easy. Also to come with another low vision device, that is the white cane. It is very important. It has made my movement very easy. I can maneuver around the environment, and especially the environments that are very new to me. It has assisted me to maneuver around and to go through to be able to I can avoid maybe where there are stairs. I can be able to move along with the stairs using the white cane, and also to maybe to get the right way, the right path using the white cane. So I really thank Kenya Society for the Blind for bringing this project to Kajiado. And we are not only me as a beneficiary. I know there are many others who have benefited with the assistive devices from Kenya Society for the Blind. So I'm very thankful. I thank the VIP project. I thank the Kenya Society for the Blind for this initiative.
My name is Alex Kaluyu. I'm the Head of Education and Rehabilitation at the Kenya Society for the Blind. The VIP program or project plays a key role in addressing matters of rehabilitations of persons who lose sight within counties of focus, and at the same time also looks into promotion of access to quality inclusive education. And these are very important aspects for us at the Kenya Society for the Blind. As such, we are here to ensure that as the project comes to an end, we set some sustainability mechanisms to ensure that those children who are out there who need to access education are mobilized and brought to the IAC for assessment and ultimately placed within inclusive schools like we have in Kiriba here in Bomet. And at the same time, we also have the CRS and our officer in Bomet County who will also continue working within the established systems like the government systems and within other partnerships to also mobilize those who lose sight and bring them for community-based rehabilitation and undertake the rehabilitation process themselves. So this is a very important aspect of ensuring that there is sustainability, and the KSB continues to work with the various partners and stakeholders to ensure that the investment that was done with the support of CBM continues to be the services continue to be accessible by persons and children with visual impairment in the county.
My name is Juliet Karimi Moturi. I work for Kenya Society for the Blind, and I'm situated in Embu County under a project called Vision Impact Project. And the Vision Impact Project is a project that is funded by Christian Blind Mission. And in Embu, we have a lead partner by the Friend Horo Foundation. And every partner has its indicators, and for Kenya Society for the Blind, we had indicators that we were supposed to implement in Embu County. And one of the indicators is issues of spectacles provision, and the community treatment outreaches and the school treatment outreaches. So we were able to provide spectacles for persons with refractive errors. Also, we worked closely on the indicators of the low vision, where we were able to assess learners across Embu County in all the 5 sub-counties. And we also provided the needed help. We were also looking on issues to do with community rehabilitation. This is rehabilitating persons with visual impairment in Embu County and ensuring that they are reached in every corner of this county. We are also key on issues to do advocacy on issues on eye health and issues of persons with disability in general, not for the VI only, but all the cadres of disability. We were able to offer support. Also, we were also able to do the mapping, that one also an indicator, or mapping of stakeholders in Embu County who can offer disability services, and that was very key. The reason why the project was came to Embu County, it's because that according to Census 2019, it shows that Embu County was the highest on issues of persons with disability. So it was the right place to ensure that we reach persons with disability in general.
Kwa majina naitwa Fantasy Munene Kevuti. Hii ni eneo mbunge ya Manyata. Mimi nimejipata like 10 years ago nikijipata kwa hii condition ya bride. It was not just a easy process to accept myself, lakini nilipatana na akina organization ya kina Juliet, wamenipeleka through rehabilitation. Na jinsi sasa mimi ni mtu nilikuwa kitambo sijajiamini, lakini nimejikubali. Nashukuru kwanza. Haya tena through hiyo organization yao wamenipeleka through, nimejikubali, nimetokea kwa watu, nimepiga maovizi, like now nimetoka kazi. Kwangu ni kushukuru kwanza, alafu naomba tu kila mtu tushikane zizi wote, tujaribu organization kama hizi zikam through kwa live za hao wazee wako kwa nyuma wamekaa rock indoors juni wengi. Na nashukuru sana our friends wenye walikuja na wakanipata, wakaniongelesha, wakanipeleka all through. Sasa niko hivyo, niko juu ya wao. Alafu tujikubali sisi majamaa, alafu Mungu atakam through. Mimi sasa nimetoka kazi na beleni sikuwa na haja hata ya kutokea ama hata kuongea na mtu, nilikuwa na kaindo za. Sasa nimejikubali na Mungu anasaidia. Ni hayo tu kwa leo.
Hello, I am Endita Wawira Ndoiga, a teacher in Kanyuambora Primary and Junior School. I am visually impaired and a teacher of SNE. I also teach English and literature in the school. And being an inclusive school, I teach both the learners with the low vision and those without the low vision. So I teach all the learners in this school. And I am glad with this VIP project, which has enabled me to teach very well in the school. The project has brought us enough materials for the teachers and for the learners. Like the resource room has been equipped with a desktop, which is very useful to us. That is where we learn our notes from. We also have an embosser, which embosses our notes from written work to braille work, and that is very important for me as a visually impaired person. It has also equipped the room with play materials, which I assist the low vision learners with. Like now we are preparing for bond games, and I'm sure they will participate very well because they have the play materials. This project has been of great importance to us, and we thank all those who have participated in bringing up the project. We hope that in the future we shall be receiving more and more from them to enable us continue with the smooth learning of our school. I cannot forget on the side of the inclusive bit of it. The school, before the project came in, had no ramps. Now the school is full of good ramps for those learners with movement difficulties. They are very comfortable. The project has also put up skylights in the classes, so the classrooms are well lit and the learners are able to learn from all corners of the classroom. So I am very grateful about the project, and I hope we shall continue cooperating to bring up and model these young learners to make them better people in the future. Thank you.
Kwa majina naitwa Rosemary Mureithi kutoka Manyata. Nafanyanga kazi ya biashara ya madizi. Nikapata kuna daktari wako huko Kairore wasaidizi wa macho, nikaenda huko wakanisaidia, wakanipima, wakanipea miwani 2022. Sasa hiyo miwani imenisaidia sana sana sana. Kutoka hiyo wakati hadi sasa mimi niko sawa.
My name is Lawrence Momanyi. I'm the project officer of the VIP project in Kiambu County. Through the project, we've been able to achieve a number of things. We renovated the IAC in Kiambu and equipped it with some devices, especially low vision devices. And we also equipped them with a wheelchair, which they also use, especially when parents come to the school. We also renovated Mugiko Primary School, which is in Lari Sub-County, and also gave them some devices for the children to play with. We have also carried out some trainings in Kiambu County. CSO SNEs have been trained, and also community rehabilitation assistants. We have also trained community health volunteers and community health assistants as well. Currently, we are repairing braille machines for persons with visual impairment, and also at Thika Primary School for the blind, we donated an embosser together with tractor paper and a computer which has Duxbury installed on it.
My name is Pauline Wanjiru, a teacher in Kiambu County, dealing with learners with special needs, and I'm happy to be part of the program. I happened to attend the VIP program for the past 4 years, and it has had a very great impact in the lives of the learners whom I handle. For one, I've got the skills on identifying the different learners who have different eye problems, the VI, the low vision one, and I'm happy for getting the opportunity to handle them and to get the skills on how to do it. I've also got the rehabilitation skills on how to go about it, that those learners whom we find that they have the low vision or they have the eye problems, we are able to go for the medical checkups, make some follow-ups, whereby by the end of it all they get registered, they get the certificates, and also we get the medical care through the follow-up activities that we get. Again, in the schools that we teach, we are able to have the inclusive measures for us to be handling those learners, including having the toilets that are improved for those learners. And I'm happy that the VIP has been of great help to us all, to the community, to the teachers, and more so to the learners who have benefited from it. We thank you, and we hope that in future we shall have more programs of the same.
My name is Francis Kareri Mwaura. I work for National Council for Persons with Disabilities in charge of Kiambu County. Today I want to thank Kenya Society for the Blind for actually coming up with the VIP project. This is a project that has come to support learners with visual impairment in Kiambu County. It has really supported them to acquire assistive devices, which has necessitated their access to education. They have also supported persons with visual impairment in education aspects by providing rehabilitation services. And you know, without rehabilitation services, they may not be able to easily be inclusive in our learning institutions. So I really appreciate the Kenya Society for the Blind for what they are doing to persons with visual impairment in Kiambu County.
I am Abed Kilemi, Education and Rehabilitation Officer, Kenya Society for the Blind in Meru County, under the VIP project, that is Vision Impact Project. Vision Impact Project is one of the major projects in Meru County from Kenya Society for the Blind that was started in the year 2022 for a period of 4 years. And its main goal was to reduce the prevalence of visual impairment and avoidable blindness. And from 2022, since the VIP began in Meru, we have seen a great milestone and a great changes and a great impact in the project as far as Kenya Society for the Blind is concerned. I can start from the community level. I can say that currently the status of the community, they have really benefited in different aspects. That is from the rehabilitation part of it and from the aspect of eye health, whereby we have issued spectacles to various patients who have been screened in the community. Then also in the school setup, we have been able to issue glasses to various students who have been found to have refractive errors. On the same note, for those who are newly blinded, we have been able to offer rehabilitation services that through the offering of white canes, doing referrals to the major schools, like for those who have learners who have got special needs and they need to be referred. So for proper placement, it has been part and parcel of the project. Additionally, when it comes to capacity building, Kenya Society for the Blind has been the forefront in capacity building of the various people that are involved in the community, starting with the community rehabilitation assistant. We have had a training on how to offer rehabilitation services to the community, which is a plus to Kenya Society for the Blind, because after the project, they will still continue offering rehabilitation services to the community. Additionally, when it comes to the education part of it, on capacity building, we have trained 20 teachers on inclusive education, and also we have also trained another 20 teachers on low vision, and also we have trained 10 curriculum support officers, that is on matters regarding assessment of persons with disability to ensure proper placement and eligibility. And on the same note, we have equipped, that is one inclusive school model, that is Middle Primary School, which is an inclusive school model in Meru County, where other schools can learn from, because we are trying to enhance inclusive education and ensure that every learner is involved. And also we have the IAC, that is Kaga for the Deaf IAC, which is the major IAC center in Meru County. We have also renovated it, and out of that, we can say that the number of assessment has increased to a point that many people are being referred to Kaga School for the Deaf. That is for the IAC, for assessment services for proper placement, even from other neighboring counties like Isiolo. And also when it comes to the development of the health facilities, we have developed an optical shop at Meru Teaching and Referral Hospital, whereby the optical shop is offering subsidized prices to the client, that is through selling of the glasses, and we sell those glasses with subsidized prices where a patient can afford, because the main goal was to ensure that we reach everybody in the community and to ensure that everybody benefit. And out of that, you can say that the project has really done a lot as far as the community is concerned, and right now everybody is appreciating more so on the aspect of rehabilitation, service delivered to the school, and also the renovation of the schools, and all other aspects as far as capacity building is concerned.
Kwa majina naitwa Protasio Motuma Lichoro. Hapa kwetu ni Moshoone, niko nyumbani kwangu hapa sasa, na niko hapa sasa nikishukuru Mungu sana kwa ule usaidizi nimepata kutoka hawa warafiki zetu wa KSB, Kenya Society for the Blind, vile wamenisaidia sana, sababu tangu nikae bila white cane nilikuwa nasumbuka sana. Niko na shida ya macho ile nilipata miaka ya hapo kitambo. Nikaenda kwa daktari nikatibiwa, ikashinda gumu, ikashindikana. Lakini sasa saa hii najisikia vile nilikuwa nimekufa moyo, ninakaa nyumbani bila hata kutoka, nikifikiria sasa maisha imekuwa mwisho. Lakini madha wamekuja kutembea huku na mashinani, walikuwa hata na madaktari wanatuangalia macho na wakajua shinda zetu. Ikawa sasa wametusaidia hata na white cane na wakatufunza kutembea. Sasa tangu tuungane nao, sasa naona nimesaidika sana, sababu naweza toka hapa naenda huko kanisani, natoka hapa naenda mpaka sokoni. Na nashukuru kwa hii shirika la Kenya Society for the Blind, sababu wanakuja mpaka mashinani. Ni wengi sana wako huku, lakini hawajui vile ya kujisaidia. Lakini tukiwa na marafiki kama hawa tutasaidia wengi. Hata vile nimepata kupata hii, hata mimi sasa nimeanza kutafuta wengine, nikiwaambia wasife moyo, ati kupotea macho sio mwisho ya dunia. Hata Waswahili wanasema kuvunjika kwa mwiko sio mwisho wa kupika ugali. Sasa mimi nilikuwa nimekosa matumaini, lakini wakati nimeungana na hawa ndugu zetu, nimejipa moyo, naweza kutembea kila pahali, kwenda kanisani, kwenda sokoni, hata kwenda kwa shamba. Naenda tu nakitumia hii white cane. Ndio naambia wale wenzangu wengine wote, hata ukiona maisha imebadilika, wewe jaribu tu kutumia maisha vile ulivyo na ujikubali. Sababu wengine wanashindwa kujikubali, wanakaa kujihurumia nyumbani, wanafikiri hapo ndio mwisho. Ukipatana na watu kama hawa, usaidiwe vile unaweza kujitembeza, unaweza endelea na maisha na unajifanyia kazi zako. Shughuli nyingi sana sasa naanza kujifanyia, sababu hata mahali sina mtu wa kunisaidia, naweza kujipeleka na chochote nataka, hata kama ni kwa duka naenda nanunua na najileta tena nyumbani. Asante sana.
I am Mother Kadure. I'm a CRA, Community Rehabilitation Assistant. I was trained by Kenya Society for the Blind in the year 2023. And after the training, I came out to reach the people living with the blindness and other disability in the community, Tigania East constituency. And I've been doing mobilization, sensitization in schools, churches, in the other stakeholders meeting. And in fact, I've met so many people. We have helped several, even small children. We have already taken 2 to Thika School for the Blind. And today they are fully sponsored. I thank the project for that. I thank the KSB for enabling the people of this community to restore hope after a while, because we have given we have helped so many people in this region with white canes, not only one. And I hope the project can continue doing the same, because still we have others, even small children with the low vision, and they need glasses and other devices like brailles. So I'm so thankful to the project, and may it continue to support our people for the betterment of the community.
Okay, I'm Faith Beryl Kasoli. I work with CBM at the Kenya Country Office. I'm currently the coordinator for the Vision Impact Project, which is a 4-year project that has been implemented in Kenya in 7 counties here. So I'm happy that under the VIP project we have been able to achieve various milestones and supported the communities that we are targeting. Like as of to date, we had a screening target of 5.3 million people in both community and school, and we have been able to screen over 5.3 million people, which we mainly attribute to the partnership and the support and also the peak technology that we embraced during our screening program. In addition to that, we intended to train 57 eye health workers at the Kenya Medical Training Colleges. We have been able to train 55 of them who are currently back to the counties. We targeted the workers who are employed in the counties for matters to enable sustainability of the project. In addition to that, out of those that we were screened, we were able to treat over 1 million at the primary level outreaches, and they received the basic treatment and were able to refer, some of them were able to refer to secondary and tertiary facilities to get other high-level treatments. So additionally, throughout the project period of 3.9 years, we have been able to conduct over 17,000 cataract surgeries and provided spectacles for over 152 patients who were identified with refractive error. So looking at the overall project targets, we have been able to achieve most of our targets and the indicators as it was designed in the program. In spite of this, there are several challenges that we have experienced throughout the project implementation. One major one was the issue of adherence to referrals. So at the beginning of the project, we find that when the patients were screened, especially at the community level, they were not coming for the services. So we had to change our strategy. We had a 2-week waiting period for conducting outreach. So we had to change and reduce the number of days where patients would wait. And with that, we were able to see improved adherence to around 65% out of the 70% target that we had. Another challenge that we had was the issue of targets. When VIP was designed and initiated, we didn't have any baseline target for eye health. Across the country, it had not been done. The RAB were done long years back. So the researches that had been conducted were not conclusive enough to help design the project. So we were able to support in the RAB survey, rapid assessment of avoidable blindness, in the 12 out of the 15 counties. CBM supported those RAB surveys, and we are glad to report that going forward, at least we have some baseline data in addition to the data that has been collected through the VIP project, so that the counties are able to use the data for decision making and also planning. In addition to that, another challenge was even our target for our baseline target for the spectacles. Because we didn't have data at the beginning, we oversurpassed our target by year 1, and we were strained by the resources. And to navigate that challenge, we embraced partnership together with the county and the implementing partners. We adopted a strategy where to bring on board other partners who are working in the eye health world to come and collaborate, so that we're able to reach out and ensure that we are connecting everyone to it. So there are various ways that each county, depending on the context, was able to adopt to the strategy that worked to them in terms of screening and also provision of services, and including cataracts and spectacles. So like the vast counties of Kajiado and Kwale, they brought the treatment outreaches very close to the community units, so that the distance that people would take to go to the facility was reduced, and thus improving the adherence level. For counties that are closer to the urban areas, we had to do a same-day screening and treatment for community. Counties like Kiambu County and Kajiado County. In the urban areas where the people live in the morning and come back in the evening, we couldn't do a screening and outreach after 3 days, so we embraced a same-day screening and treatment, and we saw that it worked for the program and enabled us achieve these targets that we had set for the program.